Hi, I'm Kathy Cleveland Bull, and I'd like to welcome you to From the Inside Out, a radio program that empowers you with the information and tools you need to take charge of change in your everyday life. Today's program is coming to you live from the studios of Brainstorm Media in Columbus, Ohio. Our topic today is taking charge of your health. Why is it that women are so diligent at seeing to the health needs of their partners and their kids, yet they often neglect their own health needs? Some of you might answer, because I'm just way too busy. I can relate to that. Our guest today will tell us why it's so important that women take care of themselves first. Dr. Rebecca Jackson is an accomplished endocrinologist, a well-known expert in the study of osteoporosis, and is a major figure in the Women's Health Initiative, a research study that examines major health issues for postmenopausal women as they age. By the way, I did find out that she knew she wanted to be an endocrinologist when she was in the 7th grade, and I'm pretty darn sure I didn't even know what that was till probably graduate school. Her new post is as director of the Center for Women's Health at the Ohio State University Medical Center. Dr. Jackson, welcome to From the Inside Out.
Well, thank you so much, Kathy. It's a pleasure to be here today.
Dr. Jackson, why have you found that women often ignore their health?
Well, I think there's probably several reasons. First of all, women, as you said, are incredibly busy. We have multiple roles in society. We have roles as caregivers for our family, our partners, and in fact our parents. We have a role in helping to support the infrastructure and the financial well-being of our families as well. And then I think that women find it very difficult to actually get good, reliable information that empowers them to be able to make good healthcare decisions together with their physicians, and therefore often find it easier to avoid the issue when they feel well rather than taking charge and doing the preventive things that will help to improve our health as we get older.
And then why is it so important that we put ourselves first in that respect for our own health?
Well, I'd like to say it's because we are so important to the well-being of all the people that we're involved with. And so by really taking charge with a personalized health strategy where I think we can get involved with the kind of 5 P's associated with this, which is personalizing our health care, looking at predictive things that help to define what our risk is for disease, being participatory individuals with this really allows us to take charge and make that difference.
That's really good. Those are simple things we can remember. Have you found that middle-aged women who are, caught in that sandwich generation, taking care of kids and parents? I know about 10 to 15 years ago, I was in that role of caring for young children, and then also had a certain amount of responsibility for my parents. We're more likely to neglect our health.
I think we are, in part because we often don't have a lot of health care problems at that time as well, so we think things are well, and therefore we tend to say, well, I can deal with this at a later time when I'm not quite so busy. But that's actually a critical time in our lives to be able to lay down the health behaviors, and in fact the foundation that will allow us to decrease our risk for having other health problems as we age.
That does make sense, that women are sort of saying, well, I'm 30 or 40 and I seem to be healthy, everything looks to be fine, so I really don't need to maybe make that annual exam or whatever.
Absolutely.
So you talked a little bit about sort of being proactive. What can we be doing, what can women be doing to be more proactive in terms of their health and sort of the partnership that they need to establish with their own physician or whoever they go to for health?
Right. I think the first is that we have to have an appetite for knowledge regarding health-related findings. So we need to be able to look at all the new information that's coming there, but then balance that information kind of within the context of a broader amount of information that's available, so that we don't swing our healthcare choices with each new study that comes out,
right,
or each new recommendation that occurs. I think second of all, we really should take advantage of the fact that they have a large amount of information now in terms of what we call personalized health assessments, where we can understand what our cholesterol is, what our weight is, what our dietary patterns are, and then to be able to make better healthcare choices that are individualized to each of us rather than taking kind of that general public health recommendation that's out there.
Mm-hmm.
Third of all, I think it's probably important that all of us find the kind of the social support that we need to be able to make healthy choices, because it's difficult to make change, and it's much easier to do that when you have partners in doing that. So develop this with friends or family or other individuals and find ways to be able to make these, and to be comfortable at knowing that little changes can have a major impact. So for example, if one feels they need to lose weight and they want to drop 50 pounds eventually, recognize that even a change of 5, 7, or 8 pounds is sufficient to significantly improve your glucose levels, improve your blood pressure, or in fact to make it easier to move around so that you can adopt that exercise regimen that you want to do. And then I think that there are some recommendations that are out there in terms of looking at your cholesterol levels, your blood pressure, regular mammography, although there's certainly been some controversy on how frequently
Right.
that should be done, pap smears, self-breast examination that women should consider doing, in addition to things like colorectal cancer screening every 5 years, something that unfortunately many women don't do, often gets forgotten, and in fact can be a way to prevent the development of colorectal cancer.
Mm-hmm. That social support, I think, is so important. I mean, a lot of women can relate to the fact that they are gung-ho, very excited about a diet change, a lifestyle change, and then the family's just really not on board. You know, the kids
Right.
don't want to eat what they have to prepare, the spouse doesn't want to, and so that really can damage the progression right away.
I think that's true. I think it's also important to realize that as women, as we make healthier lifestyle choices, we change the lifestyle choices of people around us, particularly if
everybody
we're the ones
benefits.
cooking dinner.
Right.
So that everybody ends up benefiting from it, and in fact we improve the health of those around us by making those healthier choices.
Right. And you did mention the study that was, I don't know whether it was a study or a recommendation that came out just this morning that had something to do with maybe women not necessarily needing that annual mammogram. What was that about?
So there's been a consensus panel that met, and they were looking at making some public health recommendations for mammography screening. And up until now, the current recommendations have been that women should have mammograms at annual intervals, beginning at the age of 40 or at 50, depending upon the recommendations. And this actually questioned whether that was the right interval, and should we relook at this? And they suggested that mammography screening for the general population should occur somewhat later as a woman transitions into the menopause. But it's important to put that in the context that this is one set of recommendations, and that it is a public health recommendation, and that each of us needs to take that information, sit down with our healthcare provider and our own individual risk factors, and determine from a personalized, individualized perspective what is the right thing for us. And so for individuals at high risk for breast cancer, at individuals who, for example, go through early menopause, the recommendation may be very different for us than it would be in an individual at very, very low risk, whom in fact has another set of context. So that I think it's important that we don't sway with each recommendation, but we take that within a greater context and make sense of it within our personal context.
And have a really good, healthy conversation with our own
Absolutely.
healthcare practitioner. So aside from someone not having health insurance, what do you feel are the other major reasons why women don't have proper tests
I think
performed?
it's really the convenience, the ability to be able to get kind of a comprehensive, integrated approach towards women's health care. And certainly our goal has been to try to make health care more available to women and to give them the knowledge that's necessary to empower them to make these healthcare decisions. And so the Center for Women's Health has really worked together to try to bring together things that help women across their lifespan. So moving from adolescence all the way through aging, to be able to help women to make those choices as they go kind of through critical stages in their life, with a goal, of course, to be as healthy as possible and have the highest quality of life for as long as we all shall live. Within this, we try to integrate reproductive issues, menopausal issues, and of course generalized health and lifestyle changes that will allow us to most effectively reach that.
That's really a wonderful approach. And so that new center's just opened and seeing patients. And where is it located?
So the center's located at 915 Olentangy River Road. It is right next to the Time Warner Building, with easy access on and off State Route 315. It's an absolutely incredible building.
Wonderful.
It's a really exciting protein, and really I think a new way of developing a medical home for women's health.
That's really wonderful. We're glad you're here to talk about that. And we'll be talking about that as well as other topics regarding women's health and even osteoporosis, and get other medical updates in the areas of women's health when From the Inside Out continues after this short break.